Hello, everyone at Girls Night In, and thank you for having me here today. And I thank you for bringing attention to such an important topic about the impact of COVID on breast cancer patients. I just want to start by telling you a little bit about our nonprofit organization, breastcancer.org, an organization I started about just over 20 years ago because I believe that patients with breast cancer need more information and support than just a doctor's appointment can provide. So our mission is to help people make sense of the complex medical information about breast health and breast cancer so that they can make the best decisions for their lives. We want to ensure that people have access to expert guidance on the enormous amount of breast cancer information, treatment, and research options that are available, all while they're making these big decisions that their lives depend on. Breastcancer.org is committed to being that trusted resource for both patients and caregivers, because we believe that everyone should have the best care possible for their unique situation. And in the past 20 years, we've reached 153 million people worldwide. Today, there are 20 million people that depend on us, and we're based out of the Philadelphia community, although we're at global in our reach and our team. And we have the world's largest online cancer peer community with hundreds and thousands of members. So if you or someone you know is in need of support, we welcome you to become part of our community. So now I'd like to talk to you about one of the most critical issues happening in our lives right now. And I think the word unprecedented is often used to describe the time we're living in. And for people with breast cancer, that is absolutely true. For many, there have been extraordinary unforeseen challenges emotionally, financially, and physically. Truly, no one sees a cancer diagnosis coming, and no one could have predicted the ripple effect of COVID-19 on cancer care. We're really in a time, as you well know, of increased uncertainty, anxiety, disruption, and breastcancer.org has tackled that distress people are experiencing by providing reliable information, research, and guidance. And we're committed to giving people the answers they need, as I said, to make the best decisions now. So today, I'd like to share with you all about how breastcancer.org sprung into action from the very start of the pandemic. And I want to thank any of you who've supported us and to thank you for considering your support. And I'd like to begin with a video that looks at the first few months of COVID-19.
We begin tonight with fast-moving developments involving the coronavirus here in the U.S.
The death toll from the coronavirus climbing to 6.
I was very anxious, very nervous. It was only a matter of time.
The World Health Organization is officially calling this outbreak a global pandemic.
It's unlike anything anybody has experienced before.
At least 19 states have declared a
Public health emergency.
The declaration of emergency.
State of emergency.
Shelter in place, staying at home, not being able to go out. It has a major impact on mental health that I think a lot of people weren't necessarily expecting.
The virus spreading explosively.
Tonight, more than 10,000 people have been killed by the coronavirus.
My family, I don't see any of except for my one sister who lives close by.
The toll of the virus is hard to fathom. More than 1.2 million cases here in the U.S. with
100,000 American deaths from coronavirus.
The idea that I could potentially bring this virus home to my daughter is very scary and stressful.
Coming weeks likely to test the American healthcare system in a way unlike any time before.
There's just so many layers and levels of impact with this virus.
Going through this breast cancer diagnosis and treatment during COVID has been challenging really because of the timeline.
There had been a delay in the ability to get scheduled for my monthly injection, and I'm starting to experience physical changes. I was called by the breast imaging center saying they were closing down and I would have to delay my diagnostic mammogram, and they didn't know when.
My surgery went from April to March to June.
And the message that I was given was, we'll call you. And that was very scary. I kind of went into panic mode because I was afraid if we went too long, cancer might have started coming back and it would be much bigger. So it's still sort of up in the air as to when I'll get my next injection.
Hello, I'm Dr. Marisa Weiss. I'm Chief Medical Officer at breastcancer.org, and I'm here to resolve some of the mixed message about masks.
Breastcancer.org has been incredibly helpful to me in the months since my diagnosis.
People need to be really careful to make sure that they are not being exposed to COVID and giving it to the vulnerable people in their lives.
We're all learning together how to grapple with this. You know, this is something that is touching everybody's lives. I go to breastcancer.org all the time.
There is great information about elective procedures and what does that mean for people who are facing breast cancer surgery.
I don't want anyone who is going through breast cancer and wondering, am I being left behind? Does anyone remember me? I see you, and I'm thinking about you, and I am planning for your surgery.
Many people think, oh, I could get this virus at any day and it could end my life. Well, now everybody knows what I feel like every day since I had my diagnosis.
People that have experienced cancer diagnosis have traveled these waters before. They're anxious about it, but they also are realizing that they have the tools that they're relying on now.
And remember, you are not alone. We're going to get through this all together. We will.
When COVID-19 is no longer a risk, I am most looking forward to heading to my favorite store. And I very much want to travel.
I'm so looking forward to being able to safely travel with my daughter and educate her through experiencing different countries and different cultures.
What I look forward to most is being able to hug my sister.
Tonight, closures come as coronavirus infections are now growing in 40 states, nearly twice as fast as in April.
What I would like to tell the general public about people facing cancer right now is that you may not see us.
A third straight day of record highs.
A clear trend line up, including several days last week, topping 50,000 cases.
It's important for people to understand that wearing a mask is about what's invisible to you as much as it is about what is visible to you.
We all have different levels of vulnerability. You don't know what that other person is going through.
The big question now, though, is what it all means, and what needs to be done going forward.
I'm imploring everybody who may be watching this video, when they're thinking about going out for that drink or hosting a backyard celebration, you really have to ask yourself, right now, is it worth it?
Protect yourself, protect everyone else, and protect the world.
We begin tonight with facts.
Wow. That video really speaks to the experiences so many people facing cancer right now are having. I mean, it's just, I've been a physician in the trench the whole time. And, you know, we've been walking into the hospital like soldiers and, you know, completely covered with PPE and dealing with patients that are so worried about being there. You know, we've had so many people have their care disrupted. I mean, you can just see the emotional toll it is to have a diagnosis on top of the pandemic with social unrest as well as political turmoil. It's just been so much for everybody to handle. And one of the patients I took care of, and I take care of her still, Mary is a good example. She's someone who's 56, diagnosed with an advanced breast cancer in February, needed to get on treatment right away, and she got started. Mary lives with her sister and Mary's 3-year-old daughter. When Mary was 53, she had a surprise, and she has a 3-year-old daughter in small quarters. And she goes ahead with her chemotherapy, and then COVID hits. And then in the middle of her chemotherapy, Mary develops like heart and lung complications that no one had ever seen before. And it turns out that was one of the first signs of heart and lung related COVID complications. And she could have easily died just from the COVID, being immunocompromised from her chemo. But then somehow or other, a miracle really, she finished up with she got over the COVID, she finished her chemotherapy, she went on to surgery, had radiation, and here she is today, a happy and healthy person, and hopefully still cancer-free. I just want to talk now about people diagnosed with COVID-19 while in the middle of treatment for breast cancer. You know, as I said, they've been hit doubly hard. And you probably, maybe you personally or others have been affected. And again, I want to invite you all to share your comments on the chat box, and I'll get to that shortly. So as you saw in the video earlier, breastcancer.org immediately took action, and we quickly pivoted from all of the programming plans that we'd had in place for months to implement a rapid response plan that included a living article with the latest information on health and safety. We had podcast interviews, videos, social media posts about everything from surgical and treatment delays, disruptions, to guidance for immunocompromised patients, to mental health support and tips for staying active, and much more. And at the same time, our editorial team was working on a deep dive into the long-term impact of COVID-19 on breast cancer care. Months of research and reporting culminated in a special report, which we published in the summer. And then we held a virtual town hall, which was a 2-hour program for patients and caregivers to launch the special report and to talk about matters that people were facing right now, during the whole pandemic. So now I'd like to tell you a little bit more about the special report. Well, we did, breastcancer.org did this with a purpose to help patients make the best decisions for our lives, especially when crisis strikes. And our commitment was to cut through all the noise out there in the middle of this, the noise, the pandemic, the social unrest, again, political turmoil, to cut through all that so our community would have the most accurate and important information and focus on what they needed to know immediately and their next step. And then to provide support, because we are the largest global digital internet-based organization and community, reaching and supporting people wherever they are. And of course, it's never been more important than during this time of physical, emotional, and social isolation. So starting out, just to identify the unmet needs, like many of you do in your businesses, we did a survey from April 28th through June 7th. More than 600 people answered our survey to share their experiences with breast cancer care during the first wave of the COVID pandemic. We also did about 18 interviews with experts across the country and patient interviews, interviewing individual patients to get their stories on what it was like to manage the screening and treatment issues during the pandemic. So just to hit on a few highlights during the in that report. Well, just wanted to start off by just saying that people should not put off getting the cancer treatment out of fear. We've seen that a lot of people have delayed their diagnosis, have come in with much bigger cancers that are harder to treat and require more drastic treatments. And all of us, and it's also true that none of us, with or without breast cancer, should delay seeking medical care for anything we need. We've definitely lost lives needlessly to unmanaged, unevaluated heart problems, strokes, infections, things that are very treatable, but people were too afraid to come in. And doctors and hospitals, you've probably heard, have adopted many safety features to keep people safe beyond the hand washing, the medical mask, goggles, gloves, distancing in the waiting room, staggering schedules, and all of that. So let's just talk about some of the treatment delays that have occurred. And yes, they absolutely have been delays from the beginning of the pandemic. There were delays in most, and in some cases, there's still delays right now across the country, as you know, with 23 states having rising rates and many more states still having very active number of cases on a daily basis, and they're looking like there's an uptick. Most people who are scheduled to start and continue receiving chemotherapy or hormonal or immunotherapies, they did so without delays, but there were often adjustments to treatment plans. For example, if you were to get weekly chemotherapy, instead you might get it every 3 weeks to make sure to minimize the times that you'd have to come in. Radiation, most people are going ahead with their radiation. I'm a radiation oncologist at Lancome, as you know, and more people chose to accelerate their treatment plans to get their treatments done faster. I think some of the biggest delays was in surgery. The ORs shut down because They didn't want to have all these doctors working together in close proximity, consuming a lot of PPE. Whenever you put people under anesthesia for a long period of time, they can become immunocompromised. They're using a ventilator that might be needed for a COVID patient, and the complicated reconstructions may require the intensive care units, which were filled with COVID patients. So surgery was pretty much only done for people who needed it urgently, and mastectomies may be done, but reconstruction was not done, and that's really not done for months. And while waiting for surgery, people were put on alternative plans. They were scrambling to reach their doctors to come up with a solid plan to feel protected against the cancer that they had. We also had patients who are struggling with fertility preservation, something that's very important to many women who want to have a biologic child, but the chemotherapy can damage the ovaries and the eggs. And we did absolutely hear stories of people whose ability to get in to see a fertility person in the right amount of time before treatment started, that they had a lot of difficulty. So now I'm going to shift to COVID risks for breast cancer patients. And I think it's important to know that being diagnosed with breast cancer alone does not automatically increase someone's risk of having serious complications if they were to get COVID, according to the CDC. But people under treatment for breast cancer may be at higher risk for serious complications from COVID if their treatments weaken their immune system, or cause lung problems, have lung side effects. And of course, people with breast cancer can have other conditions that put them at higher risk, like heart disease, lung disease, obesity, diabetes, or just being age 65 or older. And for people with metastatic disease, that's when cancer is spread, who need to be on continuous treatment. If those treatments weaken your immune system and you're on them continuously, you are immunocompromised and you need to be super extra careful. So all that stuff I'm sure makes sense to you. Now let's hit on the steps that people can take that I'm actually gonna, a few more of the things that people can take, what they can do right now to stay safe, and knowing that the pandemic is far from over, and we all know that it's a marathon, not a sprint, and it's important to pace yourself. So no matter what your daily life is, we all need to remain vigilant, and we all need to support each other to get through this difficult time. We have to continue to wash our hands, avoid touching our face, keep our distance from others, always wear a mask over your mouth and your nose. Make sure it fits tightly over here. Put your glasses on top of the mask so you don't steam up, and make sure it fits tightly on each side of your face. I have a big face, so mine fits just right. If you have a small face, you can twist the ear loop to make it a little bit tighter, and try to adjust your mask up and down with the loops rather than touching your face in the middle, touching the mask in the middle. This is a good time to stop smoking and vaping. Those do increase your risk for getting COVID complications. And everyone knows cancer doesn't stop for a pandemic, and our doctors and nurses are not stopping either to provide the care that people need. And breastcancer.org is working 24/7 to help protect precious lives worldwide. And with a crisis comes opportunity. And as a doctor working in the trench throughout the pandemic, I have seen major innovations and improvements in care, which will help many more people now and in the future. Now let's talk about outreach. Just to give you a few highlights from our special report. You can read about it at breastcancer.org/COVID-19. And through all this work, we have reached so many people, and these numbers don't capture even the questions that have been sent to us by our community that we've answered directly through multiple platforms to provide guidance for people wherever they are, whenever they need it. But for our town hall in July, we had 1,700 people register from 46 countries, then 10,000 views of our special report, 50,000 social media impressions. We were covered by the Today Show, and next up is Spanish, and we're trying to raise funds to translate that report to people, so people who are only Spanish speaking have access. That is, if anyone knows somebody who is committed to that community, we welcome your participation. You can chat with us as a group and put your questions in the chat room, on the chat box along the way. Just to share some of the messages we've received from people who attended the COVID-19 and breast cancer care town hall. Our goal is truly making a difference in people's lives, and that's the driving force behind everything we do. And this work will continue, of course, because the pandemic isn't going anywhere anytime fast. The goal for all is to provide the resources so that we can communicate with clarity and compassion, to give people what they need when they need it, and to reduce their risk of having a complication in their treatment plan, as well as from COVID itself. Everyone knows Mr. Rogers, and I grew up with him. Many of you did too. And he gave us a quote that I think is really, really apropos. He said, "We live in a world in which we need to share responsibility. It's easy to say, it's not my child, not my community, not my world, not my problem. But then there are those who see the need and respond." And he said, "I consider these people my heroes." And I say to everyone who is doing their part to protect others in big and small ways, particularly supporting people in the breast cancer community right now, you are my heroes. Which brings me to all of you. I know we've each had our own struggles during COVID. We're not living our healthiest lives. Personally, and I can speak for others, I know, gain weight, you're drinking too much alcohol, you're not physically as active, people having a lot of emotional isolation, social isolation. We're missing our friends and colleagues. So we care about you, and we want you to stay safe and continue going to your doctor for screenings and other appointments. Please take care of yourself. And one way that you can do this is to make sure that you get your flu shot as soon as you can. They want you to get it before November. We only have a few weeks left. If you're over 65, you might get the bigger flu shot. You also might get the pneumonia shot if you're a candidate for that. And it's important to do in case, because you don't want to be dealing with the flu and COVID at the same time, as you all know. So we want you to stay safe, and now's the time you can get your flu. You talk to your doctor, but you can get your flu shot in many places other than the doctor's office. So now I want to just thank you all for your participation in Girls Night In. And again, thank you to Shelley for arranging this, and Cindy Pelton's on also, who's my right-hand lady at breastcancer.org. And what I'd like to do now is to go to the chat box. So I'm going to stop and share here. And let's see the chat here. We've got a few people coming in there. Thank you. It says here from Tracy from Facebook Live, what extra steps can someone on chemo take to protect themselves now? Would you ever suggest waiting for treatment or for a vaccine? I'm so glad you asked that question. So I would not delay your treatment. I don't know where you're calling in from, if you're from a big hotspot or you're from the East Coast where things are more under control. But I just would rest assured that the doctor's offices are taking enormous precautions to keep you safe and to make sure that you get the best care possible. Treatment delays can result in worse outcomes. We don't want you to do that. But what I would do is I would definitely wear at least a medical mask. You can also take that one step further and use an N95 mask. Make sure it fits your face, covers your nose, your cheeks down like this, and that you use the folds of the mask to unfold them to cover all of your face. You can also take an extra step because COVID, you can catch COVID through your eyes, nose, and mouth. So you can use safety goggles. These are safety goggles that are for a workman station. You can get them on Amazon. They're not only do they cover my glasses, but they're protection at the top, and there's protection on the side. That's an important thing. You can look for goggles around the house until yours come in the mail. You want to make sure that that you socially distance in the waiting room. That if you're sick, you don't go in, of course. You want to also just keep yourself upbeat and engaged. make sure that you have your support network. One thing that breastcancer.org put out is, if you know someone who's dealing with breast cancer right now, they're not okay. Just assume they're not okay. Reach out and offer to help, because people going through breast cancer now, their friends are not as available, or their friends don't have the same capacity to jump in and just make dinner and deliver it. Everyone's got so much stuff, hitting the fan. People are struggling to keep their own lives together. They may not have the bandwidth and the capacity to help you as well. So you do need to kind of speak up and let people know what you need. Thank you again. And in terms of the vaccine, all of us want to know when the vaccine is going to become available, or about the number of vaccines that are going to become available that we're all waiting for. They all work in different ways. We don't have enough information right now to know how they work, which one's the best one, who should get it first, what the side effects are. But it is true that the American public or the global public will not be protected until the vaccines are safe and effective, and that at least half, if not 2/3 or 3/4 of people have either had an infection and have some protection from that, hopefully that's sustained, or have had the vaccine. That's called herd immunity. 2/3 to 3/4 of our population must have either been infected or had an effective vaccine in order for the population in general to be protected. Right now, 90% of people have not been exposed. So our public, our population, our world, the United States, is still very vulnerable. We have to take this very seriously. Anne asked, would you recommend travel by air for anyone who is on chemotherapy? No, I would not recommend travel by air, even though they use great filter systems, HEPA filter systems. Even if you wear a mask, you have gloves, even if you don't drink anything or eat anything while you're on the flight, and even if you don't use the bathroom, because you can't guarantee that you're going to be at least 6 feet away from somebody else. It's a better recommendation to be 12 feet away. And while they may screen people with questions and with temperatures, they're not doing rapid COVID testing on everybody. So I would not do that at this time right now. Is it possible to have breast cancer with a normal mammogram? From Anita on Facebook Live. Thank you for asking that question. Breast cancer is the most common cancer to affect women. The most common way it's detected is by mammography, but it's not perfect. Mammography can miss, even the best mammograms can miss about 10 to 20%, sometimes 25% of breast cancers. So we can't use mammography alone. We need to use mammography, your own breast self-examination, and your doctor's examination, and we need to correlate those different tests together. And also, if you're at higher than average risk because you have a known breast cancer gene that puts you at high risk, or you have a strong family history, or you have a combination of those two, then you may need to be followed by mammography, MRI, sometimes ultrasound, your doctor's exam, your exam every 6 months, but in alternation. So let's say you get your MRI in January, you get your mammogram in June, and you'll be looking for a 3D tomo mammogram in that situation. Should someone with metastatic breast cancer get the flu and pneumonia shots? Generally, for sure, the flu shot, but you want to ask your medical oncologist if your immune system is good enough to respond to it. Make sure it's strong enough. And then pneumonia shots most likely, but you ask your doctor about that in your particular situation. Thank you for that question. Barbara from Facebook Live asked, my sister's going through chemo and I'm trying to help her. Do you think it is okay to be in a room with her if I stay 6 feet away? So good question. I don't know where you live, Barbara, and where your sister lives. So it's best to get together outside. Good for her to get fresh air, you to get fresh air, 6 feet away outside. If you're inside, I would say 12 feet away is better, and that you should have windows open. It's good for you to wear a mask. You should never visit your sister. If you have any symptoms or if you've been exposed to anybody with symptoms, do not visit your sister in person. Find cute ways for you to visit your sister virtually. Have a regular phone call. Have lunch together, you know, set up a Zoom call or something else and have lunch together. Listen to SNL together. Listen to other comedians together. TV shows, other ways that you can be together. Then another thing is, a question came in about the shingles vaccine. Should you postpone it if you're going through radiation? No. If your doctor has recommended that you get this shingle shot, and usually it's 2 shots in sequence, separated by a period of time, then you can go ahead. It's generally speaking, radiation to the breast and even to the lymph nodes doesn't lead to significant immunocompromise of your immune system. So you're usually able to get a vaccine and be able to respond to a vaccine so that you get protection. Another question from Anna Lisa from Facebook. Can you drink alcohol when you're getting radiation? So first of all, alcohol is a medicine. Truly, I mean, it's what people use to relax, chill out. It's also a reward, a treat. It goes great with good food or even bad food. Makes bad food taste better. And it's a way for people to end a long, really tough, horrible day that what a lot of people are having during the pandemic. But generally speaking, alcohol is not good for you for a number of reasons. You know, it can change you cognitively. Of course, you're not supposed to drive when you do it. It can put extra, it's a lot of liquid calories. It disinhibits us, so we eat more. So there's a lot of weight gain is associated with alcohol. Also, the more you drink, the higher the risk of breast cancer. And unfortunately, that's true. And a drink equals 5 ounces of wine is equal to 12 ounces of beer, which is equal to 1.5 ounces of hard liquor. And I love tequila, so that's a bummer. And in terms of alcohol equivalency, and generally we say stick to 3 or fewer drinks per week. Alcohol, more women are drinking alcohol. Women and girls are drinking alcohol, and we're drinking more of it. So the connection between alcohol use and breast cancer risk is most significant for women before the menopause. So that's a tough one, right? Because you see how many of you have daughters or nieces or sisters that are before the menopause and you're watching them drink, and you know it's not a good idea. And so the more you drink, the higher the risk, especially before the menopause. But if you are beyond the menopause, doesn't have the same impact, but it certainly leads to increased weight. It absolutely disrupts sleep. It interferes with sexual function for you and your partner. If your partner is drinking, let's say it's a he, it takes him a lot longer to finish, which is not so happy for your little, for Miss Little Vagina down there. So there's a lot of and for you, it slows your response. So it's not a healthy thing to be drinking. That said, we want you to enjoy life, enjoy good wine. There's a lot of on breastcancer.org about how to maximize your, how to enjoy alcohol in a way that and avoid over drinking. So, when you're thirsty, you're going to drink water. If you're drinking before dinner, you're going to drink much more alcohol when you're not eating. You tend to drink alcohol slower when you're eating. You can make an agreement with the person who's holding the bottle not to fill you up. That's particularly true at a restaurant where they're trying to sell you more bottles of wine and they keep filling your glass up. You try to avoid that. And then it's good to alternate what you're drinking. I'll show you what I'm drinking right now. This is what I make I try to make fun things to drink. Not that I'd be drinking alcohol now anyway, although it is 5 o'clock somewhere. But this is a tea I make with a lot of fresh ginger. And towards the end, in the middle, I put in some of those candied orange slices from Trader Joe's or candied lemon slices, in a large pot of water with a ton of fresh ginger. I put in 2 or 3 of those candied orange slices just to cut the bitterness a little bit. And then towards the very end, I put mint in. figure out whatever it is you like. It's a great drink and it tastes special. You can put it in a wine glass, put fresh mint in it, and it's a great experience. And I recommend it. And then we have another question from Nadira. Are there better chances of survival from breast cancer now than 10 years ago? Amen, hallelujah, absolutely. We are, helping more people overcome their breast cancer challenge and live what we hope to be their full life view. But I must say that there are enormous health disparities, and those disparities have become much worse during the pandemic. And I have patients who, and particularly women of color, who have had delayed diagnoses. They're more likely to have more aggressive types of breast cancer that presents in later stages. Their doctors are less likely to spend time with them or take their requests seriously. Let's say, for example, asking for genetic testing, they're less likely to get genetic testing when they ask their doctor. There's a tradition of mistrust, and that's been in place, and all of those issues, which are huge, have gotten worse during the pandemic. And breastcancer.org is committed to getting rid of those health disparities through partnerships and making it a high priority. I'm on the CDC Advisory Committee for Young Women with Breast Cancer, and breastcancer.org is working with Touch, an important group, and other groups that are addressing this issue. Now we also have, I'm just looking, we're still okay for time, a question about eating sugar. Does it feed cancer cells, and does it make it worse? Is that true? So I'm glad you asked that question. It's a goal when you're eating. I know there's so many reasons to eat, right? And anybody who's tried Noom will tell you, like, you're eating when you're bored, you're eating when you're anxious, when you're upset about something, you go right down to the kitchen. I'm certainly guilty of that, right? But the main thing is that you should be eating for your nutrition. Most of your nutrition should come from a vegetarian-based diet. That means vegetables, fruit, nuts, seeds, grains, spices, from all the colors of the rainbow. That's where most of your nutrition comes from. And you want to have your proteins as a side dish: meat, chicken, pork, fish, whatever you like. And your goal is to give your body nutrition and to keep a very steady blood sugar in your body, and not have these sort of wild peaks that go up and down. That's like rock and roll for the inside of your body. That happens when you eat junk food and a lot of sugars that are sugar added to, like soft drinks, like sodas. Even diet soda can make your body think that you're ingesting sugar and give you these peaks. And what happens when your body goes up and down like this, is your body responds and releases hormones. Often insulin growth factors, insulin-like hormones, and other things that get triggered that are not healthy for your cells. It's like being at a party when they turn the music on and off, and it's very loud, and they turn it off, and they turn it loud, and so it's like chaos. Your cells don't like it. They want a steady state. It's like the country right now, chaos. Everyone wants to have someone in leadership that's in control of what's going on out there, so that we can lead our lives healthy and in peace. So when you eat a lot of sugar, it triggers and it overstimulates the cells that live in your body, including cancer cells, if they are there. So we don't want to do that. We want to eat well, and we want to keep our blood sugar as even as it can be. And that means avoiding sugary stuff and sugar-free drinks. That is not healthy. Proteins from plant bases and from animal bases, they give us a nice constant blood sugar, make you feel better. It's also true that when you eat a lot of sugar, and you have maybe a sugar high, once the high starts coming down, it triggers a craving for more. And that's when people eat their next piece of candy or their next cookie or the next piece of cake. My advice to you is don't bring it in the house, because willpower is thin right now for all of us. Don't tempt yourself. Stay out of the kitchen. Find a buddy right now to help you manage the weight gain that nearly everybody has experienced. You know, I gained 15, maybe 13 pounds during the pandemic, and I was out of the house working every day. Why? I wasn't going to the gym. I was feeding family that was here. I have 2 sons that are 6'3" and like eat like horses. My husband's eats a lot, and I was sort of eating at the same rate that they were, and I was drinking more alcohol and enjoying it. And so why do you think on TV right now you have a million commercials from Noom and everything else? It's because they know everyone's gained weight. It's not just January 1st of the new year, it's everywhere. So I would, one thing that's helped me the last 2 weeks, just to share in case it's useful to you, is I have 2 close buddies, and we weigh ourselves each day and share the weight on a text message, and we encourage each other. There are days that I've done well and days I've plateaued and days that go up, and I can't explain it because I was good and I still get punished with a bad number. But the general trend is, the idea is to go down and to do it through emotional support. Some people need an incentive to lose weight, and do what works for you. One of my 2 friends that I connected with, I said to her, you know, if I go up, like, you know, yell at me. She goes, no. We're beyond that. She's, you know, let's stop body shaming, and let's try this in a supportive way, because we want it to make this happen in a way that you feel support, you feel self-respect, and you succeed, and you do it over time safely and effectively. I don't know if any of that helps you. Jennifer here, thank you, Jennifer, for sharing. So in addition to the pandemic, she is sharing that she finished chemotherapy in April and gained 35 pounds, which you're finding impossible to lose, and is weight gain during chemo more difficult to lose. So just so you know, weight gain during chemotherapy is very common. 25, 35 pounds, depending on where you started from, is common. Why? Why does that happen? It's because many people are on, during the you're on ACT, during the Taxol or Taxotere, during those chemotherapies, you're pumped up with steroids to minimize your body's reaction against the chemotherapy or the vehicle in which it's given. And that those steroids produce weight gain. And also, chemotherapy alters your taste. You might have a metallic taste. Things don't smell right, taste right. So then you go to foods, you tend to go to foods that are more caloric, that are comfort foods. So don't knock yourself, Jennifer. Today is the first day, and the main thing, the goal right now should be to head in the right direction, and to make sure that during the upcoming holidays, the Thanksgiving and Christmas and New Year's, that you don't gain more. Right now, make sure you don't gain more between now and the end of the year, and try to get closer back to where you want to be, to a healthy weight. You can do it. It's going to take time. One thing that's very important and very helpful, and was helpful to me, I too was diagnosed with breast cancer 10 years ago, and my doctors told me, Marisa, you have to lose like 25 pounds. I'm like, oh God, how am I going to do that? Well, one thing that helped me was just to understand that when it comes to exercise and diet, and you keep hearing all your life, diet and exercise, diet and exercise, diet and exercise, like, oh, brilliant one, thanks so much, right? Like, as if I didn't know that. But you kind of think it's 50-50, diet and exercise, diet and exercise. It sounds like 50-50. It's not. Does anyone want to guess at And what it actually the ratio is, how much does diet and how much does exercise influence weight management? I don't know if anyone wants to jump in the chat box and share that. 80%. Bingo. So Lisa, thank you. And Lynn, 80-20. So you're exactly right. 80% of weight management is what you eat. 20% of weight management is exercise. Okay, wait a minute, it's not that easy. Well, let me just explain that one more time. For example, you eat a piece of cheesecake. Let's say it's 500 calories. It would take you hours and hours on the treadmill to get rid of that. So again, 80-20, 80-20. And as we get older, our metabolism slows. So we don't need to consume the same amount of food to keep our engines running. Unfortunately, that's what's not fair about, one of the things that's not fair about life, right? You would think that at this point in life, we deserve to enjoy our food and have as much as we've always had. But that's not the case. We have to eat less in order to stay at the same weight because we're not burning as many of the calories. But there's a hook. And the hook is that the most effective strategy to help you lose weight and keep the weight off is exercise. So that's the catch-22. It's 80-20, but if you want to get in the groove and get on a roll and stay on task and feel your willpower and keep going, you must exercise regularly. And you have to mix it up so that it's fun and interesting, that there's a variety going on, and that that you're not bored with it. If you can do it socially, you can use an app, but if you can exercise with a friend, like I get on the phone with a friend of mine who lives 40 minutes away, and I talk to her while I'm walking, we catch up. So instead of sitting and talking to her, I get out and walk talking to her. That's what I do. Another thing is that how is it I basically starve myself and still gain weight, from Emily. And that's a frustration that many people have. And so what I would say is meet with a nutritionist. Ask your doctor to connect you with a nutritionist to say, what am I doing that's working? What am I doing that's not working? What barrier, what's going on here, to explain what's going on, to why you feel like you've gained weight despite being good. We don't want you to starve yourself, for sure. Lucy says, I'm stage 4 and freaked out when I gained 15 pounds. The doctors were happy and I don't get it because I have bone mets and I feel the weight is going to increase the pain. Well, weight, you want to get to and stick to a healthy weight as much as you can. When you're being treated for metastatic breast cancer, it usually requires continuous treatment. And your weight will go up and down depending on the treatments you get, depending on the steroids that they give you to support you. Don't knock yourself out about it. A 15-pound weight gain is not enough to put so much extra strain on the bones. But generally speaking, weight bearing does help keep bones strong. But if you have weak areas of the bone, you do have to be careful. And then we have another question that Elise is asking for breastcancer.org. So we are the #1 online resource for breast health, breast cancer information. Most people who come to us are people who are diagnosed with breast cancer, men and women around the world, or people who had a mammogram that showed a problem, that have a scare, they're worried, they're waiting, they got the mammogram, they're waiting to see a doctor, there's a week there or 2 weeks there they're worried about, or they had a biopsy, they're waiting for the results, they don't know what to think, and they are waiting to meet with a doctor. So, during those times, that's who we see, people who have a breast cancer gene abnormality or people with a family history that's significant. They come on, but also a lot of healthcare professionals come to breastcancer.org. We have research news. We cover all the major conferences. We are the place to go to get the best medical information that's written by medical experts and medical editors. There's a question about a keto diet, a vegan keto diet. So most of your nutrients are going to be coming from produce, vegetables, fruits, grains, rice, seeds, spices, as I was saying. And if you are a vegan, you have to make sure that you are taking in enough plant-based proteins to keep you healthy and to keep your body strong and able to run the show, healing and repairing and operating your cells and, being as healthy as you can be. And I would just, really ask you to meet with a nutritionist to really make sure that your protein levels are good enough, that and not just in your diet, but that you verify it with your blood test to see if you're on the right track. And then Melissa asked if you have had mastectomies, will you ever have sensation or pleasure, or is it always going to be numb? And the fact is that for a lot of, that song by Joni Mitchell, they take paradise and they put up a parking lot. Well, when they remove breasts, they usually remove the nerves. And so that this whole area here feels numb and often weird. Like you can feel someone touch you, but it feels kind of weird. And in general, it's not a source of pleasure like maybe it was before. However, sometimes those nerves do grow back, and sometimes they grow back in funny places. Like they can grow back and you might discover more of an erogenous zone on one side of your neck or in the armpit, or you just are resourceful and creative and you find other parts of the body that give you a new playground to play in, a source of fun. And, for those of you who've been through breast surgery, including mastectomy, with or without reconstruction, that, and anybody else who's listening, and I know we're almost at 5 o'clock, that your mind is your most powerful organ, including your most powerful sex organ. And there's a lot you can do with, reading cool, fun things or fantasy or movies, or to put you in the mood so that you're more receptive to sexual engagement. I'm just going to reach over here. Hold on one second. This is a book that I give to patients. It's called She Comes First. For as you grow older, with or without breast cancer, you need to vary up what you do sexually because your body has changed, your relationship may have changed, your partner may have changed, and your partner may not have the same capacity that he or she did before. And you might want to use toys or other things to get you in the mood. But this book is very helpful for people who have sexual difficulty. All you really need to know is the title, because when a woman has an orgasm first, her vagina gets longer, wider, thicker, and wetter, and more receptive to intercourse if that's what she wants to do. And if having intercourse is the goal that you set out, then you're having an orgasm first, either through oral sex or with a vibrator or manually, whatever gets you off, then you're going to be much more receptive and able to handle intercourse, so that it's more comfortable, maybe even pleasurable and not painful. Lots of lubricant is necessary. Uber Lube is probably the best lubricant to use. Make sure that your partner has not been drinking alcohol, because if he or she has been drinking alcohol, it's going to take them a lot longer to finish, and it's not going to work well. And there comes a time that you're like, say, enough is enough, right? And finally, just to let you know that at breastcancer.org, because there are questions about, more about what we offer, we have information on everything from prevention, detection, diagnosis, treatment, recovery, survivorship. Some people have recurrence. So people living with metastatic disease, people who have a breast cancer gene. We have a whole section called Think Pink, Live Green, that I'm looking for my, Think Pink, Live Green, that is all about how to stay healthy in your everyday life. It's for anybody, not just people with breast cancer, because whatever goes in, on, and around you can affect how your cells are built and run. So we at Think Pink Live Green on breastcancer.org, you can read about what you to eat, what you drink, what you breathe in, the medicines you take, the personal products you use, how to make those choices in your everyday life, and how to model that, lead that. So when you've got daughters watching you, you're doing the best that you can. We all at breastcancer.org, we are so grateful for your, and on behalf of myself and Cindy, who's on with me, and my team, thank you for your attention today, for all your great questions. And for those of you who want to support breastcancer.org, we want to thank you. We know many of you give at whatever level you can. At breastcancer.org, there's a donate button, and all of our services are provided at no cost to women all around the world. And your donation this year will help us manage the COVID crisis for people, to help us break down the health disparities, and to make sure that each person gets the best care possible. So thank you.